Welcome to Cultural Diversity Training. My name is Desiree Cochran Norfolk. This is the Culturally Competent Counselor. This course is designed to equip you with the awareness and knowledge and skills necessary to provide effective counseling across cultural contexts. When we use the term culturally competent counselor, we're suggesting that there's an endpoint or a certificate of perfection. But instead, cultural competence is an ongoing process of growth. It's a lifelong journey of becoming more aware of yourself and more attuned to your clients, and also being more responsive to the systems that are shaping people's lives. So as you're moving through this training, I'm going to encourage you to keep two things in mind. First, cultural competence is about humility, acknowledging that we don't have all the answers, but we can approach clients with respect and curiosity. And second, cultural competence is about advocacy, recognizing the inequities and working towards change, not just in our therapy room, but in the larger environments that are affecting our client well-being. Also attached with this training is a workbook for your convenience. Multicultural counseling is more than just simply working with diverse clients. It's a professional commitment to attuning counseling to culture. We're also attuning it to context and also to power. And so at its core, multicultural counseling addresses worldview, how the clients are seeing themselves and their place in the world, and also how they're understanding mental health and healing, and how systems and identity are going to intersect to shape those experiences. But it's also concerned with equity. We want to make sure that counseling doesn't just treat everybody the same, but that it's actively working to create fair access and engagement and outcomes across different groups. And so that means understanding the role of racism and sexism and classism and homophobia and ableism and ageism and all these isms and other systemic forces that are shaping our clients' distress. So this multicultural counseling is going to require us to adapt. We need to learn from our clients so that we can meet them where they're at, and it's going to help us to choose some interventions that are going to fit with their cultural context. Ultimately, this is about building authentic and respectful partnerships that are going to promote growth while honoring the client's identity. So the US is one of the most diverse countries in the world, and it's becoming even more so every year. Census data shows really rapid growth in racial and ethnic and linguistic and generational diversity. And at the same time, identities are going to intersect in increasingly complex ways. So a single client may identify as biracial and bilingual and non-binary. Maybe they're identifying as working class and also as Catholic. And each of these identities is going to shape their worldview and their experiences of privilege and oppression. So this traditional one-size-fits-all counseling model is going to fail in that context. But a model that's built for like middle-class heterosexual white men, for example, is not going to adequately serve low-income immigrant women or even LGBTQ youth of color. So the implication here is really clear. If we want to be effective as counselors, then we have to recognize the diversity, that diversity is not an exception or a special population. It's the norm. And so for us as counselors, demographic change means responsibility to learn and adapt. We have to continuously update our approaches. And it's also going to mean that we have to prepare to serve communities that historically have been excluded or harmed by our mental health systems. The future of counseling is multicultural, and we have to be ready for that. So before we dive into the applications, let's ground ourselves in a few key concepts that really form the foundation of multicultural counseling. Culture means the shared values and beliefs and practices and traditions that shape how people interpret the world. Cultural encapsulation is when counselors impose their own cultural values on clients and we fail to see beyond the client or our own worldview. Individualism versus collectivism. So individualistic cultures are going to emphasize autonomy and self-direction, while collectivistic cultures are going to prioritize community and interdependence and family roles. We see that a lot in Asian communities. Race and ethnicity. So race is is a social construct category that's tied to like power and hierarchy and control. But ethnicity is referring to cultural heritage and traditions and really just a shared identity. Generational status, whether a client is first generation immigrant, second generation American, or maybe it's multi-generational citizenship, is that's really going to shape their acculturation and their identity development. Gender and sexual orientation, these are core aspects of identity that are going to intersect with these cultural norms, and also the systemic oppression of them. Socioeconomic status is like a person's financial resources, their class background, access to opportunities that are directly influencing their health or their stress or their resilience. Disability, this could be physical, mental, or even developmental differences that are intersecting with stigma and systemic barriers. Spirituality, for a lot of people, this is a vital source of meaning and resilience and coping. So as counselors, grounding practice in these concepts is going to help us to notice patterns, and it's also going to help us to avoid assumptions. We're going to have to ask better questions that are going to honor our clients' lived reality. So when we talk about multicultural counseling, it's going to be impossible to separate the counseling process from the broader social dynamics of power and inequality. Advocacy is a little bit more than just speaking on behalf of the client in the moment. It really means like promoting ideas or policies or even like systemic changes that are going to create better access and outcomes for our clients who have been historically underserved. So this is going to help a person really navigate an educational barrier, or it could mean working at the organization level or even a policy level to change some unjust practices. Privilege is going to refer to the unearned advantages that certain groups receive because of their social identities. So, for example, we have white privilege, male privilege, economic privilege, and these are often invisible to people who hold them, but they are profoundly shaping the experiences of those without them. The thing is, privilege is not about blame. It's about awareness of the ways that systems give people a head start while other people are going to face barriers. Oppression is the other side of privilege. So it's the systemic denial of access or power or resources to either an individual or groups. And that can show up as overt discrimination, but it can also appear in a little bit more subtle ways like biased policies or social stigma. And it can also pop up in like limited representation in leadership roles. So for counselors, understanding oppression is not just theoretical. It's going to shape the client's trust and how they engage with us, but it's also going to affect the outcomes of the treatment process. So our task is to recognize how advocacy can encounter oppression, how it's going to counter the oppression, and then we really need to critically reflect on our own position of privilege so we can prevent any unintentional reinforcing of those dynamics. So up to this point, I've kind of identified some key multicultural concepts, but the next challenge is to learn how to actually integrate and contextualize them into our practice. So knowledge alone doesn't equal competence. So for instance, like understanding the definition of acculturation is useful, but How is that going to impact your conceptualization when the client is navigating generational conflicts between their immigrant parents and their US born children? Integration is moving beyond theory to application. So how do these concepts shape the assessment questions that I'm asking? How are they informing the interventions that I'm choosing? How are they guiding the way that I'm interpreting the symptoms? So for example, here, like what might look like resistance or denial in one culture context may actually be a culturally normative expression of respect or privacy. So contextualization means recognizing that like these multicultural concepts, they're not abstract. They always play out within lived systems like families or schools or workplace or the healthcare system, or even like within religious communities, or even the broader socio-political climates. So to be effective, we have to consider how identity and privilege and oppression and communication styles are intersecting in each client's reality. So in short, integrating these multicultural concepts into counseling is about weaving culture into every part of the process rather than just treating it as an add-on. So competence in multicultural counseling doesn't develop in isolation. It's going to require a systems approach. So we need to think of it in 3 layers. So at the self level, counselors need to cultivate cultural self-awareness. And that's going to include ongoing reflection on our personal values and like any biases that we hold, or our own cultural identity, and how all of that is shaping our perception of our client. Self-awareness is really just being willing to challenge our blind spots and actively pursue growth. Then we have the session level. And at this level, competence is going to show up as culturally attuned counseling skills. So we want to use language that our clients are going to understand. We want to respect the communication norms. And we also want to apply interventions that are going to resonate with the client's worldview. It means being flexible, adapting our theoretical approach to the cultural context rather than just expecting the clients to fit into a rigid model. So at the setting level, we're going to recognize that counseling is taking place within larger systems like agencies and schools and healthcare environments and things like that. And those systems can either reduce the barriers or reinforce those inequities. So a competent counselor is going to advocate for institutional changes that are going to increase equity, like expanding access for non-English speaking clients, or even pushing back against diagnostic practices that are going to disadvantage certain cultural groups. So a systems approach is cyclical. Growth in one layer is going to support growth in others. And it's not really a checklist that we're completing once. It's kind of like a lifelong iterative process where our competence is not measured not just by like what we know, but how effectively that we're promoting this equity, and if we have any positive outcomes in every layer of the counseling environment. And communication is at the heart of counseling, but it's also one of those primary sites where cultural missteps are going to happen. So let's start at verbal communication. This is going to include language. Some of our clients are not going to be fluent in English, or maybe they speak in dialects that are unfamiliar to us as counselors. And even among the English speakers, we have regional and cultural differences that are going to shape word choice and also the meaning of words. Then we have jargon. So as professionals, we need to avoid clinical or academic jargon that's going to alienate the clients. Words that feel routine for us in training may feel judgmental or confusing or stigmatizing to those clients. So we want to steer clear of using that clinical jargon with our clients. We also need to be concerned about our pacing. Some cultures value like very quick, direct exchanges, and others are going to value thoughtful pauses and like a slower pace. So misinterpreting those norms can harm the rapport that we have with our clients. And then with directness, some cultures are going to prize like direct honesty, and others are going to value indirectness as a form of respect. So, for example, like a client may avoid saying no directly to maintain that harmony. So the key here is going to be for us to adapt our style to the client's norms. We don't want to expect the client to conform to ours. And that flexibility is going to help build trust, and it's going to minimize any misinterpretations between you and your client. Now let's move on to nonverbal communication, because this is 85% of communication is nonverbal. It's body language. And nonverbal communication often communicates more than words, but it is also deeply cultural. So with eye contact, in a lot of Western contexts, direct eye contact is seen as a sign of honesty and confidence. But in other cultures, like avoiding eye contact shows respect. And so as counselors, we need to avoid pathologizing behaviors that might be cultural norms. Also with space, different cultures have different comfort levels with space. So sitting too close or too far may be interpreted as being disrespectful. A lot of Hispanic cultures, they don't mind being very close to the person, but in the American culture, we want lots of space in between. So kind of making sure that we're giving that space and being respectful, and not sitting too far away from certain cultures that would consider that disrespectful. We also want to look at affect display, like the emotional expression, because it's going to vary across different groups. So what might look like flat affect or flat emotion to one counselor may just be cultural modesty or restraint. So if counselors are imposing their own cultural interpretations onto nonverbal cues, we're going to risk rupturing that therapeutic alliance. So the goal here is to observe carefully and ask questions and just remain open to alternative meanings. Emotional expression is another area where cultural misunderstandings are going to come up. So in some cultures, open displays of emotion are valued and encouraged, while in other cultures, emotional restraint is seen as a sign of strength and maturity. So for example here, like a counselor might interpret a client's reluctance to cry as avoidance or repression, but in the client's cultural context, holding back the tears may demonstrate dignity or resilience. Also, a counselor might assume that anger is problematic, but in some cultures, it's a normal way of demonstrating passion or commitment. So we have to learn to check our assumptions as counselors and ask about the meaning of the emotional expression. We want to avoid over pathologizing the differences there. And that sensitivity is going to ensure that our clients are feeling respected and understood rather than judged and misinterpreted. Communication patterns are going beyond individual and verbal or nonverbal signals. They're reflecting larger relational norms. So, for example, in some cultures, children are not expected to speak freely in the presence of adults, while in other cultures, open dialogue is actually encouraged. So a counselor that's unfamiliar with those dynamics may mistakenly interpret a client's silence as resistance rather than just cultural respect. And misreads like that are going to rupture that therapeutic alliance. So once a client feels misunderstood or judged, they're probably going to shut down. They're going to disengage, and they may even terminate counseling altogether or try to find another counselor. So our role as counselors is to really just continually monitor our interpretations of client communication. Rather than assuming meaning, we can ask, can you tell me what that gesture or pause means for you? That humility is going to open the door to better understanding and stronger alliances. Clients don't enter counseling as blank slates. They are going to bring with them all of their histories of prejudice and discrimination that are going to shape how they experience the counseling process. And discrimination may be based on race or gender or class or sexual orientation, disability, or multiple intersecting identities. And experiences of prejudice are often going to contribute directly to presenting concerns that clients bring, like depression, anxiety, trauma, low self-esteem, low self-worth, substance use, relational difficulties, all of that. So these experiences may lead clients to mistrust counseling, particularly if the counselor is seen as a representative of the dominant institution. I get a lot of clients that come in and somehow think that we work for probation because they're on probation and the probation officer told them to go get an evaluation or go get treatment. So they believe that we work for that dominant institution. And so they're going to come in with a lack of trust in the process. So our task is kind of twofold. We need to validate the real harm that clients are experiencing from prejudice, and we have to help them build coping and reliance strategies without minimizing that systemic nature of the problem. We have to balance the empathy for their personal pain with recognition of like the structural forces that are at play. Immigration experiences are really going to profoundly shape the client's identity and their mental health. And clients may face culture shock. There might be language barriers or isolation. So acculturation is the process of navigating between different cultures. And that really creates a lot of stress for people and for families, especially when children acculturate faster than the parents. So that's going to create some intergenerational conflict. Violence and trauma are also significant. Refugees may carry some war-related traumas. Immigrants may experience violence, like at the border or maybe even in resettlement. So stigma may come up from that dominant culture and also from within cultural communities themselves. And that's going to create some additional levels or layers of challenge for us to work through. And we have to be attuned to those contexts, recognizing that struggles with depression or anxiety or relational conflict may not be rooted in personal failure, but in the stress of the immigration or the stress of acculturating and also past traumas. So systemic barriers are often going to block access to the counseling services and other forms of care. And so clients are going to face some logistical barriers, like maybe they don't have transportation or it costs too much or they don't have insurance. And they may have some interpersonal barriers, like they don't trust us as providers. And that could stem from some historical mistreatment of those marginalized groups. Misdiagnosis is also another barrier. So maybe, for example, like cultural idioms of distress may be misunderstood as a psychiatric disorder. So a client describing soul loss may be misdiagnosed with depression, and that's going to lead to treatment that seems irrelevant or even harmful for that client. So culturally competent counselors are going to work to reduce systemic barriers by validating the client's concerns. And we also need to like adapt our services to what they need. And we want to advocate for more accessible systems because we recognize that counseling doesn't just happen in a vacuum. It's always embedded in systems of care and also in systems of justice and inequalities. And a lot of communities carry collective memories of violence and oppression. So we have historical trauma like slavery or colonization or genocides, forced relocations, and that's going to continue to affect the descendants generations later. That trauma is going to show up in health disparities and mistrust of institutions. There's going to be some intergenerational cycles of pain. And so our clients that were exposed to the community violence or police brutality or domestic violence or whatever kind of violence may experience compounded trauma on top of all of this. So we have to recognize both the individual and the collective dimensions of those experiences, because we know healing is going to require acknowledging the larger historical and cultural context, not just focusing on the person's individual psyche. So like for example, when we're working with Native American clients, we have to understand the impact of boarding schools and broken treaties. That's going to be essential for us. But on the other hand, like for African American clients, we have to acknowledge the legacy of slavery and systemic racism. That's going to be critical in dealing with African American clients. Without that historical lens, counseling risks oversimplifying or even invalidating that client's experience. So a systems approach is going to emphasize that competence develops across multiple layers. So as I discussed earlier, at the self level, we're going to engage in that ongoing reflection and cultural humility. And at the session level, we're going to adapt some skills and strategy to fit the client worldview. And at the setting level, we're going to advocate for policy and systemic change to improve equity. So we want to make sure that our practice produces equitable processes and outcomes for our clients. One of the things that we need to make sure that we're avoiding is failing to recognize that counseling is a social justice profession. Counselors who avoid advocacy may unintentionally reinforce oppression by leaving systems unchanged. So improved practice is going to require integrating advocacy into our counseling, whether that means just supporting clients in self-advocacy or working at the institutional level. Another pitfall is the etic versus emic debate. Etic approaches assume universal truths about mental health, while emic approaches emphasize cultural specific meanings. And competent counselors are going to balance both. We need to recognize the commonalities across humans while also respecting the cultural uniqueness. And we want to avoid rigid extremes. We want to practice flexibly and effectively. Another pitfall is going to be assuming that all members of a cultural group are going to share the same belief and experiences. In reality, within group differences are often greater than between group differences. So we have to avoid stereotyping and approach each client as an individual. I could think of many different things that I don't agree with or I do agree with within my own culture. And a lot of communities are also going to underutilize counseling services because they don't trust us. There's a lot of stigma, or they just don't have access. So we also need to throw in there like conflicting cultural values, like collectivist family expectations versus individualist counseling models, because that's going to further complicate engaging with the clients. And we also need to address stigma directly. We want to kind of normalize help seeking and adapt our interventions to align with our clients' values and their cultures. So awareness of those dynamics is going to allow us to build stronger alliances and also build more relevant treatment plans. Mistrust of the counseling profession is really a powerful barrier. A lot of groups have experienced harm at the hand of medical and mental health systems. So counselors have to earn that trust. We have to be humble and consistent and transparent. Misdiagnosis often happens when counselors lack that cultural understanding, and that's going to lead to irrelevant or even harmful treatment. And inaccessibility of services, whether that's due to cost or location or language or whatever, that's going to limit engagement. And then, finally, some counselors are going to resist multiculturalism itself. They kind of see it as political or unnecessary. And that resistance undermines our ethical responsibility. Multicultural competence is not optional. It's central to ethical, effective counseling. So to bring this all together, let's consider some clinical examples. So imagine working with a client in addiction treatment who is attributing their relapse to soul loss. A culturally encapsulated counselor might dismiss this as, oh, they're just in denial. A culturally competent counselor might ask about the spiritual meaning of that experience and integrate culturally congruent healing practices. Motivational strategies also need to be culturally responsive. So, for example, we might frame recovery as an individual achievement. Maybe it resonates in individualistic cultures, but when we frame it as a responsibility to family, that may be more effective in collectivistic cultures. And then lastly, advocacy is essential. And that might mean that we need to help our clients access resources. Or maybe we need to go to bat and challenge some of those discriminatory policies. Or maybe we need to step outside of our agency and work with some community organizations to remove some of those barriers. Multicultural competence is not just knowledge. It is action, applied flexibility, and just being respectful in a real world setting.